Good morning and a warm welcome to Alder Hey Children's Hospital for your Pediatrics B Year 4 rotation. I'm Dr. Joyce Lim, your Year 4 lead for Pediatrics B. Firstly, allow me to introduce to you the medical education team headed by Helen Blackburn and supported by Lindsay, Natalie, Liz, Jamie and Carol. The team representative will be based outside Lecture Theatre 4 at the Institute of Education during your placement. Here are some of the student facilities, namely the kitchen area, changing room, shower room, student room, lockers and notice board, all located at the Institute of Education whilst you are here at Alder Hey. If you're not sure where things are, please do not hesitate to ask the undergraduate team for help. I'll take you through a quick overview of Pediatrics B, dividing this into 1. What students expect from this placement, and 2. What the University of Liverpool expects of the students via the e-portfolio completion. Alder Hey can definitely help you with the 3 Ps, professionalism, preparedness, and punctuality. So what should the students expect from this placement? We hope that we will help you fulfill your PEDS B learning objectives as shown below. Number 1, to take history from children or their parents or carers, presenting with a variety of pediatric conditions or symptoms. Number 2, to examine children of varying ages. Number 3, to formulate a differential diagnosis and select appropriate investigations and to discuss the acute and longer-term management. To understand the consent process and applying principles of capacity. Number 5, to perform a patient risk assessment and to know how and when to raise patient safety and safeguarding concerns. Number 6, to describe and perform a variety of clinical procedures. Please see your jobs list. Number 7, to describe common investigative and surgical procedures, as well as to understand the roles of members of the multidisciplinary team. Number 8, to describe patient journey from admission to discharge. Number 9, to communicate effectively with patients, family members, and their carers. Number 10, to appreciate the psychosocial impact of medical conditions on patients and their family members. And finally, to develop professional values and to understand the legal framework of practice. We hope to help you achieve this by organizing the 2 weeks of PEDS B placement into 1 general week and 1 specialty week. We have organized a range of scheduled activities including ward rounds, clinics, theatre, A&E and on-calls, multidisciplinary work team placements, specific teachings including safe prescribing, CBLs and pharmacy teaching, bedside teaching and education supervisor meeting, and we hope to introduce you to some pediatric specialties. For your scheduled activities, it is essential that you remember to check your timetabler. You'll be divided into groups of 3 to 4 students to 1 educational supervisor. Remember to check your timetabler for the full list of your scheduled activities. Remember to check before attending an activity, and if your activity does not happen, check again for any last-minute changes. If any scheduled activity is cancelled or missed, please let the undergraduate team know as soon as possible so it can be rescheduled at the earliest convenience. In terms of specific teachings or tutorials, you would have had your pre-placement primer already completed on a Friday before the start of your current placement. You would have a placement induction session on day 1, safe prescribing, pharmacy teaching usually on Wednesday, CBLs on both weeks, bedside style teaching will be organized by your education supervisor, and online lectures in the academic week. In terms of a CBL, please be reminded to read the material provided before the CBL to gain most benefit from the session. Please remember to read around the topic before the CBL and recap after the CBL in a self-directed learning style. In terms of your bedside style teaching, we will aim to show you some cases on the ward or the clinic and discuss about the case by the bedside or away from the patient, and it may be useful to read more about the cases after the teaching as a means of self-directed learning. So now, let us get into the PEDS-B curriculum in terms of the e-portfolio requirements. We hope that with the scheduled sessions that we have organized, that you will be able to complete your PEDS-B e-portfolio curriculum sign-off. You should familiarize yourself with these requirements. Let me expand this further on the e-portfolio requirements. During your 2 weeks in PEDS-B, you will be expected to achieve the following. 1. Minimum of 2 CPATs or cases of complex or chronic conditions. Minimum of 2 examinations of OE with at least 1 examination of a child under 3 years of age. 3. To complete several DOPS, see your list, during clinics, ward rounds, theatres, on-calls, or at A&E. 4. A minimum of 1 reflection on your reflection pro forma for untimetabled activity, for example, CPATs, OE, DOPS, or A&E. 5. Attended and student declared with brief summary of minimum of 2 ward rounds. Attended and student declared with brief summary of minimum of 2 clinics. Attended a theatre session and following a patient journey and complete with a student declaration. To do 2 student declaration with brief summary of experience for on-call and A&E sessions. And finally, have attended 2 multi-professional working sessions complete with a student declaration. Please remember that prior to your ES meeting, that you complete your student comments or self-reflection before meeting your ES for the first time. Turning our attention to specific sections of the e-portfolio, let's start with cases or CPAT. The university requires a minimum of 2 CPATs or recommends at least 3 CPATs. These should include a range of cases, for example, growth problems or abnormal movement. The CPATs must include a child with complex needs or one with a chronic condition, for example, asthma, cystic fibrosis, diabetes, or epilepsy. The CPATs can be done during ward work time, with the cases chosen from recommendations during ward rounds or on call. Please remember to ask the sister in charge of the ward or nurse in charge of patient before seeing the patient or the family. The cases can then be presented to doctors or A&P of different seniority or to your ES, making sure that at least 1 CPAT is signed off by someone ST3 or above. For your OE section, the university requires a minimum of 2 and recommends 3 OE to be completed. At least 1 of your OE needs to be done on a patient aged less than 36 months. The OE can be done during bedside or bedside style teaching, or can be done after a ward round, but remember to ask the sister or nurse in charge before approaching the patient. Or it can be done during A&E, on calls, clinic, or theatre session. Please make sure that at least 1 OE is signed off by the ST3 and above. It would usually be helpful to have your phone and e-portfolio app filled in for your OE and have it signed off at the same time. In terms of procedures or DOPS, please look at your list of DOPS to be done. Please remember to be opportunistic and get these signed off during clinics, ward work, theatre session, A&E, or on call. PEFRs, peak flows, are no longer routinely done at Alder Hey and has been removed from your pediatric DOPS requirement. Ward rounds require student declaration, and at least 2 need to be completed. It may be helpful to read around or about any interesting cases seen during the ward rounds. Try to think about 3 new things that you might have learned during the rounds. There's usually ample opportunity to go back and see any interesting patients for OE or CPATs, which can be done during ward work time. There will also be opportunity to do some DOPS after the ward round, like urine analysis, swab taking or vital signs, but remember to ask the nurse or sister in charge before doing so. At least 2 or recommended 3 clinics with completed student declaration is required by the e-portfolio. Again, it may be helpful to read around or about any interesting cases seen. There will also be opportunity to do DOPS, for example, child growth measurements and recording, inhaler technique, vital signs, and urine analysis. There will also be opportunity to do clinical examination during clinics if the clinics are not too busy. For your theatre or investigative experience, the university requires a minimum of 1 student declaration, The aim during the half-day theatre session is to allow you to follow a child on a patient journey. During this time, apart from taking a history and observing the patient journey, there will also be opportunity to do some DOPS, example wound closure, wound care, or surgical scrubbing. It may be helpful to read around or about any of the interesting cases that you might have seen. Please be reminded that you will need to change into theatre scrubs, have shoe covers or appropriate theatre shoes, hair all neatly tucked into the blue theatre hat. Special hats are also available for those with facial hair or beard. And remember that you need to be bare below the elbows. If you're unsure, please ask. You will each have 2 on-call scheduled activities, 1 A&E placement and 1 on-call, either medical or surgical on-call. It is expected that you complete a student declaration for each, and it would be ideal if you could complete a student reflection for your A&E placement. To expand this further, during your 1 A&E placement for each student, you'll be expected to attend a 10-minute teaching at A&E at 12 noon, followed by watching an A&E video after the teaching. You will formally sign in at A&E at 1 p.m. Between 1 to 8 p.m., you'll be expected to take history, review patients, follow a patient journey as allocated by the A&E team. Please try to be opportunistic to get DOP signed and to present your cases of CPAD and get that signed off as well. Between 8 to 9 p.m., you will have time to write up your reflection using the standard student reflection pro forma. For multi-professional working exposure, you'll be expected to do at least 2 student declarations. Each of you will be allocated to at least 2 of the following: place specialist, ward pharmacist, pediatric dietitian, nurse specialist or advanced nurse practitioner, attendance at MDT meeting. Occasionally, you may be able to tag along an occupational therapist, perfusionist, or ECG technician. For your e-portfolio requirement, please remember to complete your student reflection on untimetabled activities, for example, CPADs, OE, DOPS, and A&E, with a minimum of 1 per placement. Your education supervisor will review this during the final meeting and feedback. Your placement evidence attachment will be able to be seen by your educational supervisor to make sure that there's at least the minimum requirement that is met. At the end of your placement, feedback and marking will be made based on unsatisfactory, borderline, satisfactory, good, or excellent. I'm sure all of you will be very keen to know how you will be assessed during PEDS-B rotation. As you can see, this placement outcome, there's a range of outcomes possible, ranging from unsatisfactory, borderline, satisfactory, good, or excellent. The majority of you will be awarded satisfactory, whereas a smaller proportion will be awarded good, and a very small group of you may be awarded an excellent outcome if you have managed to demonstrate a broad portfolio in addition to all the standard e-portfolio activities. In terms of your placement attendance record, please remember to sign in each morning. Sign-in is available outside Lecture Theatre 4 at the Institute of Education, and sign out at the end of the day. A separate QR code will be available to be scanned for those on call or in A&E. The university is very strict on this attendance record, and there will be no exceptions from the university and no retrospective appeal. Be reminded that if you miss more than 20% of your placement, which means your attendance is less than 80%, you will need a formal catch-up on Canvas. However, if you miss less than 20%, that means your attendance is more than 80%, then you can complete any outstanding e-portfolio during your self-study time. Any catch-up or repeat placements will need to be discussed formally with the University of Liverpool Year 4 team and filled in as a separate form on the e-portfolio. Finally, you'll be expected to have 2 ES meetings during your 2-week placement in PEDS-B. Typically, during week 1, you will get a brief introduction and reminder of the e-portfolio requirements. You can present your CPADs during this time. Your ES will also review any potential issues that you may have. During week 2, Your ES will again review any potential issues that may arise. It will allow time to present CPETs if necessary. The second and final ES meeting will usually involve reviewing of your e-portfolio to ensure all requirements are fulfilled. The university also expects the feedback form to be completed by the student. If the ES meeting is delayed or does not happen, please remember to let the undergraduate team know as soon as possible. Please be reminded that the e-portfolio sign-off needs to be done promptly by the end of the second week of placement. Any planned delays in sign-off will need to be specifically discussed with your ES. Finally, please remember that we, the undergraduate team, are here to help. The undergraduate team will be sat at the desk in front of Lecture Theatre 4 in the mornings. If any session is missed or cancelled, please let the undergraduate team know as soon as possible so that alternative sessions can be organized. Please remember to sign in and sign out daily, as this cannot be retrospectively confirmed. Any absence or absences to be informed to the undergraduate team as soon as possible. ES teams have been allocated, and if there are any issues that arise, please let the undergraduate team know. Remember to check the timetabler regularly in case of last-minute changes. If you need to contact us, the undergraduate team, myself, your Year 4 lead, or the clinical sub-dean, Mr. Adam Dunn, the emails are as follows. To conclude, we hope that you will enjoy your experience at Alder Hey Hospital. A lot of the skills that you have already learned before are transferable to pediatrics and vice versa. Babies and children are very interesting indeed and not at all scary. And perhaps finally, we may yet make future pediatricians out of you. Thank you and enjoy your time at Alder Hey.